Okay, so we did our presentation on amyotrophic lateral sclerosis, also known as ALS, and it is Peyton Arney, Bethany Ingram, and Faith Glaspie.
As an overview, ALS is a progressive degenerative disease in which scarring forms on upper motor neurons, and this also affects the functionality of the linked lower motor neurons. Overall, ALS is a slow process of neuron destruction. There is no known cause of the disease. However, research suggests that there is a genetic link that is a significant risk factor. However, it is presumed to be acquired and sporadic. Treatment includes medication management. Medication can help someone stay in the milder stages of the disease, but it does not necessarily increase their lifespan. And new research may suggest stem cell therapy can be beneficial.
So, in this disease, some physical changes that you could see is asymmetrical foot drop and weakness of small muscles of the hand. And this is more in the initial changes that we could see. So we have some pictures, the foot drop. And then if you look at the hands and just the thumb muscles, they're a lot smaller. We can also see progressive loss of muscle movements, muscle atrophy, spasticity, fasciculations, which is muscle twitching, dysphagia, which is difficulty swallowing, dysarthria, which is impaired speech, and then hyperreactive reflexes. And then we also can see some fatigue. And this all varies depending on the stage of ALS they're in.
Cognitive changes could include reduced executive functions, changes in language abilities, personality changes, difficulty recognizing facial expressions, difficulty interpreting emotions, or ocular motor palsy, which is like a paralyzation of the eyes. And all of these changes could lead to trouble with communication.
Individuals with ALS can also experience emotional changes such as reduced emotional control, which can include laughing or crying at inappropriate times, even when they may not feel happy or sad. They may even feel emotions more intensely than normal, and they may have trouble shutting off an emotion once they feel it. These emotional struggles can also be known as emotional lability or pseudobulbar effect.
Okay, so for our first assessment, we chose ALS Functional Rating Scale, and it is revised. So it is about 12 questions, and it'll take approximately 10 minutes to administer. This assessment assesses gross motor and fine motor skills, and scoring can range from 0 to 48, and the higher the score means the more function that they do have. So this assessment measures speech, salivation, swallowing, handwriting, cutting food, handling utensils, dressing and hygiene, turning in bed, adjusting bedclothes, walking, climbing, and breathing. So the intervention that goes along with this assessment could be education on adaptive equipment and durable medical equipment. And adaptive equipment would increase independence, their safety, and their overall quality of life. So education on the equipment is going to be essential for their understanding and their caregivers' understanding and the caregiver's ability to help them. So for example, at the bottom, we have a picture of someone using a universal cuff with a utensil. So in the assessment, this could go right along with handling utensils, and this will give them more control and independence with their feeding. Next, we have a tilt and space wheelchair, which helps with positioning and just transportation. So this could be education on safety outdoors, crossing busy streets. And then same with the shower chair, that would go right along with hygiene, and same with toileting. And then for the reacher, for example, an intervention could be dressing and hygiene, or picking things off the ground, and that could be with home management or adjusting the bedclothes as the assessment measures that.
The next assessment is the ALS AQ 40, and this is a 40 item questionnaire from the Oxford University Innovation Lab. And questions include if they have fallen or tripped while walking, if they have difficulties standing up, getting out of their chair, walking up and down the stairs, as well as if they have difficulties performing jobs around the house. The higher the score indicates a better quality of life, and the client or someone close to the client can fill out the questionnaire. However, it is preferred that the client fills it out if possible, just to get the most accurate score. And there is also a modified version of the ALS AQ5, which is just a 5-question, much simpler questionnaire to also gauge how somebody's health-related quality of life may be affected due to ALS. An intervention that can go along with this assessment would be teaching energy conservation techniques. And techniques would include prioritizing what is important to accomplish for the client, and then teaching the client that it's okay to ask for help if needed to complete other tasks, planning out their day to include rest breaks, and then eating a healthy and balanced diet just to get as much good nutrition as possible. And these energy conservation techniques can help a person perform those tasks around the house that they are having trouble with, and they also feel is as important to get done.
So for the third assessment, the modified Ashworth scale can be used with ALS clients to measure spasticity of upper extremity and lower extremity. MAS will test resistance to passive movement about a joint with varying degrees of velocity, and then they will assign a grade of spasticity from 0 to 4 on an ordinal scale. But there are 6 choices, so you can refer to the graphic in the or the right bottom corner to understand each level of scoring. And then an intervention for managing spasticity would be incorporating stretching, passive range of motion, and self range of motion to prevent contractures and overall decrease pain from contracture and spasticity. And it's important to emphasize that both the client and caregivers should start performing this early in the disease process and daily as well. And overall, this will help reduce pain and stiffness in the client's joints. So this can help our clients maintain flexibility in making overall movement easier and helping maintain their independence in ADLs and IADLs.
Okay, and then here are our references.